The Honourable Dr. Ayesha Verrall.
Thank you, Mr. Speaker. My question is to the Minister of Health. How many procedures were performed in the new Totara Haumaru surgical building for the most recent month, other than January, for which data is available? And how does this compare to the monthly average if Totara Haumaru's projected annual capacity of 15,500 surgical and endoscopic procedures were evenly distributed throughout the year?
Mr. Speaker.
The Honourable Simeon Brown.
I'm advised that in February 2025, a total of 720 procedures were completed at Totara Haumaru. As the member will be aware, this is different to the 15,500 procedures evenly distributed, as the facility was opened with the intention of delivering 2,000 elective procedures in the first financial year. I'm advised that Health New Zealand is on track to deliver against this target as work continues to ramp up at Totara Haumaru. Once operating at full capacity, it is projected that up to 8,000 surgeries and 7,500 endoscopy procedures can be performed within the complex each year.
As we stand by his statement, I want as much planned care as possible to be delivered in partnership with the private sector when existing public facilities are being underutilised.
Well, Mr. Speaker, as the member will be aware, the last government, which built Totara Haumaru, failed to allocate the funding to operate it. It's a bit like the Yes Minister show, isn't it, where you've got an empty hospital and nothing's actually able to be done. And so the former Minister of Health had to find the operational money to be actually able to get the hospital operating. They're now gearing up the hospital so that it can deliver what is required to be delivered.
Not time for a speech.
Is it acceptable for surgeons to work in private hospitals during the hours they are paid to work in public hospitals, as requested by one of the private hospitals bidding for the government's outsourced procedures?
Well, Mr. Speaker, if the member is wanting to have a debate around using the public or the private system, I would point her to a cabinet paper taken by Chris Hipkins to Cabinet back in 2020, which said that there will be an increase in the use of private providers in order to make the best use of all capacity that is available in the health system.
That's all good. That's all good, but the question will be asked again.
Is it acceptable for surgeons to work in private hospitals during the hours they are paid to be working in public hospitals, as requested by one of the private hospitals bidding for the government's outsourced procedures?
Well, Mr. Speaker, as I said, if the debate is going to be around whether or not we should use the public system or the private system, I would point the member to a cabinet paper taken by Chris Hipkins as Minister of Health to Cabinet in 2020, where he said there will also be an increase in the use of private providers in order to make the best use of all capacity that is available. It also said the Ministry is facilitating discussions with the New Zealand Private Surgical Hospitals Association to ensure a national approach is developed to access private hospital capacity. We want to make sure we maximise the best use of both.
And I'm sorry, but it might be interesting to some. We'll hear the question again, and the Minister will attempt to answer the question.
Is it acceptable for surgeons to work in private hospitals during the hours they are paid to be working in public hospitals, as requested by one of the private providers bidding for the government's outsourced procedures?
Well, Mr. Speaker, one of the things we've outlined is to ensure that there are proper arrangements between public and private systems, particularly around workforce, to ensure that we are growing the workforce together, and so that the ad hoc basis that has been happening in the past, and she's outlined an example, which is the type of behaviours which have been happening in the past. We actually want to see long-term agreements put in place, just as was outlined in the Cabinet paper that Chris Hipkins took to Cabinet in 2020.
Thank you. Who is correct? Christopher Luxon, who on 7 June 2022 said, "Privatisation is not a big philosophical driver for me at this point in time," or Simeon Brown when he said, "I'd like to see as much planned care, those elective surgeries done by the private sector"?
Well, Mr. Speaker, I think the answer to that question is that Kiwis needing elective surgery don't care who's providing it. They want it done in a timely manner. And under the last government, the number of people waiting more than 4 months for elective treatment increased by 2,500%. So we're on the side of getting things done, And just as Chris Hipkins took to Cabinet in 2020, we're going to use the public system and the private system to get it done.
Supplementary
question, the right honourable Winston Peters.
On the basis of that answer, is there a medical condition called an own goal, and can it be fixed?
The Honourable Dr. Ayesha Verrall.
Supplementary. Has he been...
Just wait till everyone's calmed themselves down. Okay.
Has he been advised that performing 10,579 additional elective procedures in private hospitals will mean that the milestone of 63% of patients waiting less than 4 months for elective treatment in the current financial year will be met?
Well, Mr Speaker, I've been advised that the Health New Zealand will be both insourcing and outsourcing in order to achieve that number by the end of this year, so that we can make sure we are increasing the number of elective surgeries being done. And as I said in my previous answer, I don't think Kiwis waiting for elective surgery are caring too much about who's delivering it. They want it done, and that's what we're focused on doing.
Peeni, Henare.
Thank you, Mr Speaker. My question is to the Minister of Health. Is he committed to the same health outcomes for Māori as his immediate predecessor?
The Honourable Simeon Brown.
Mr Speaker, my focus, as was the focus of my predecessor, is on ensuring that all New Zealanders, including Māori, have access to timely, quality health care. We know that too many New Zealanders are waiting too long to be seen at emergency departments, receive first specialist assessments and have elective surgeries. Unlike the previous government, our approach is putting patients first and backing our health system to get health back on track. This starts with bringing back our critical health targets, which the previous government removed, to drive better outcomes for all New Zealanders, including Māori.
Supplementary. To the Minister. Does the Minister agree with the Honourable Dr Shane Reti when he said, quote, "I want to see iwi Māori partnership boards powered up to support the health outcomes for your whānau and your communities," end quote? If so, what does powering up independent iwi Māori partnership boards mean?
Well, Mr Speaker, my predecessor was very clear about independent Māori partnership boards, that they should be providing consistent advice around health needs for Māori across the country, and that these partnership boards should not be commissioning agencies.
Supplementary. Has the Minister seen the overwhelming evidence that Māori die 7 years earlier, that Māori are twice as likely to die from cardiovascular disease, and that Māori are more likely to get type 2 diabetes? And if so, why do none of his health targets specifically address any of these issues?
Well, Mr Speaker, the 5 health targets that this government put back in place, which the last government removed, are for all New Zealanders. Because it's not just whether someone going to... Every New Zealander expects to be able to turn up to an emergency department and being able to be seen in a timely manner. All New Zealanders expect that if they require elective surgery, that they're able to receive that in a timely manner. This government is focused on timely, quality access for all New Zealanders, which includes Māori.
Supplementary.
Just wait for it. Okay.
Does healthcare for all New Zealanders mean raising the life expectancy for Māori or lowering the life expectancy for non-Māori?
Well, Mr Speaker, the government's focus is on improving health outcomes for all New Zealanders, for Māori and for non-Māori. And I just make this point, Mr Speaker, to the other side. They removed health targets, and every single one went backwards for non-Māori and for Māori. All New Zealanders were worse off because of what they did when they decided to rearrange the health system in the middle of a pandemic. Shame on them.
A point of order, the Right Honourable Chris Hipkins.
Those are actually relatively straightforward questions from Peeni Henare on a relatively actually a very serious topic about the fact that Māori have lower life expectancy than non-Māori. You'll note that there's not any political insult in the question. It's asking for government policy on that. And instead we've just had a diatribe from the Minister about health targets and the actions of the previous government. It's not unreasonable to ask that he address what are straight and serious questions.
The question you suggest is serious. Ask if the government's policy was to raise the life expectancy of Māori or lower the life expectancy of non-Māori. And I think that inside that there was then enormous scope for answer. It wasn't a totally straight up question at all, in my opinion. However, the Minister may like to address the question that was asked, which I understand is if you wanted to shorten it, I'll give you the chance to shorten it so we don't get the flick at the end.
Thank you, Mr. Speaker. Does healthcare for all New Zealanders, for this government, mean making the life expectancy for Māori and non-Māori the same?
Yes.
Supplementary question, the Honourable Winston Peters.
Does the Minister give any credence...
Just a minute, sorry, we'll start again. Please start again.
No, she'll be interested in this question. Does the Minister give any credence to the fact that internationally, diet is the most important thing towards longevity, as proven by populations like Japan, and we could do far more in terms of changing the Māori health outcomes by getting serious dietary change?
Well, Mr. Speaker, as members of this House know, there are a range of factors which impact on health outcomes, and it's critically important we're focused on them. But what I would say is we are focused on improving health outcomes for all New Zealanders.